Thank you, Mr. Chairman. Dr. Stone, as you well know, it's really important to me to make sure that we are providing care for veterans who are facing fertility challenges as a result of their service. But I want you to know I'm continuing to hear about obstacles for veterans who are trying to access this care. I'm hearing that providers and veterans are unaware the care is available. I hear about long delays in processing and approving the requests, and I've even heard about providers who are putting their own opinions ahead of the veteran and actually refusing to give them access to treatment. It is really critical that after these veterans have sacrificed so much in their service, they're fully supported. And fertility challenges are difficult enough without having to fight a bureaucracy to access care that they have earned and that they're entitled to. And as we all know, delays in this means sometimes they can't access care and have kids. So I don't want to hear about this anymore, and I want to know what the VA is doing to address those barriers and make sure veterans get the care when they need it.
Senator, this is such a critical point. We do have very structured guidelines, referral practices, so that the local staff, the local providers do have instruction on how to make these referrals, how to actually review fertility for service connection, because of course there are very strict rules on how we actually can provide fertility services. But as you are hearing of these individual cases, our office can definitely make moves to make sure that these individual veterans do receive the services that they deserve and are warranted to receive. Over the last year or so, there's only been about 400 or so cases. There's very small numbers nationwide, so we do have the capability to really dig in on each and every one of those and make sure not only that they're evaluated appropriately, but that we also have a provider in network that can actually provide those services.
Okay, those are great words, but I want to see them put into action, and I want you to know that we're hearing that that's not happening out across the country.
Sure.
And Senator, with each and every one of those, if we could have direct contact, we would appreciate it, because when a patient comes to you, it often can take a little bit of time. We need that direct contact, and appreciate the relationship that we have, that you will bring that to us.
I will do that. All right. Dr. Stone, another topic, implementing the expansion of the caregivers program, as you well know, is significantly behind schedule. We've talked about this before. I have significant concerns over any proposal that would cut eligibility or limit service to our veterans and their caregivers. And I do want to thank you for being transparent and upfront with me about the VA status when we met in December. But it is time to get this program moving. Our veterans are waiting. These services can make a tremendous difference in their quality of life. So I want to ask today, when will we see the proposed caregivers regulations, and will they propose any curtailing of services or eligibility?
Dr. McDonald has been working this actively, but let me say to you that it should be this month that you will see the regulations.
This month, as in February.
As in February, yes, ma'am.
Senator, the expansion of this program, as you know, is something we have welcomed in VA for a long time. We are thrilled to be able to provide this benefit equitably across all eras of care, and especially to be expanding first to those pre-1975 veterans, those Vietnam-era veterans who we know have a significant need set and who we know face a burden of illness that is often higher on average than the cohort that we have previously served in the post-9/11 generation. Individual by individual, certainly any burden of illness can be high, but we know that this cohort is significant, both in their own burden of illness and in the average age, as we anticipate, of the caregivers caring for them. Oftentimes, this is a spouse who is delivering that care day in and day out. Sometimes it's another family member, but we expect the average age of these caregivers to be over 70, and by design, this program will meet the needs of each of these eras equitably. You will see us expand in a way that's consistent and builds upon the more than 15 programs that serve this population now. The stipend program that is specifically expanding, we are hiring more than 680 staff across the nation and have hired them at the regional level, at the VISN level, In every region, they are already in place ahead of the expansion, which we anticipate this summer. In addition, we have 50%, more than 50% now of the support staff on board, and we're in strong partnership with IT, stronger than ever before. And we anticipate that both the regulation, as it becomes final, as Dr. Stone said it will publish this month, but as it becomes final this summer, that will come in line with the IT systems being delivered, and then this program will expand this summer. And we anticipate also reaching back to those veterans and caregiver pairs who have already reached out to us and expected this, as you said, on October 1st. We will be reaching back to all of those veterans who applied and guiding them through the process if they still want to be part of the program when the expansion happens.
Okay, we will be watching for that and stay in touch. And I'm out of time, but I did want to just say that I'm hearing a lot of concern about the department's referral process to community care and quality and coordination. I'll be submitting a question on that, and I hope to get an answer as quickly as possible. Thank you, Mr. Chairman.